Aminoglycoside toxicity, mechanisms, risk factors, and clinical management. Aminoglycosides are potent antibiotics effective against gram-negative bacteria, but their use carries significant risks of nephrotoxicity and ototoxicity that require careful monitoring and dose optimization. Introduction to aminoglycosides and their clinical role. Aminoglycosides represent an important class of antimicrobial agents that have been utilized in clinical practice for decades. These medications function by interfering with bacterial protein synthesis, making them particularly effective against gram-negative aerobic organisms and certain other bacterial pathogens. Their bactericidal action provides clinicians with a valuable tool for treating serious infections, particularly in hospitalized patients where gram-negative infections present significant clinical challenges. However, the same pharmacological properties that make aminoglycosides effective antibiotics also contribute to their potential for causing serious adverse effects in treated patients. Understanding aminoglycoside-induced nephrotoxicity. Nephrotoxicity remains one of the most clinically significant complications associated with aminoglycoside therapy. When these antibiotics are administered, they accumulate preferentially within the proximal tubular cells of the kidney, where they can cause direct cellular injury. The mechanism involves the generation of reactive oxygen species and the disruption of cellular processes essential for maintaining kidney function. Patients receiving aminoglycosides frequently experience elevation of serum creatinine and reduced glomerular filtration rates, indicating diminished kidney function. The incidence of aminoglycoside-induced kidney injury varies considerably depending on patient factors and treatment parameters, but can affect a substantial proportion of patients receiving prolonged therapy. Key points: proximal tubular cell accumulation of aminoglycoside drugs leading to concentration-dependent toxicity. Oxidative stress generation within kidney tissue causing cellular dysfunction and death. Impaired cellular ion transport and metabolic processes in renal epithelial cells. Potential for reversible renal dysfunction when treatment is discontinued early. Ototoxicity, damage to hearing and balance systems. In addition to kidney-related complications, aminoglycosides can cause irreversible damage to the inner ear structures responsible for hearing and balance. This ototoxic effect typically manifests as permanent sensorineural hearing loss, which may affect specific frequencies or progress to involve broader ranges of hearing. Some patients also experience vestibular toxicity, manifesting as dizziness, vertigo, and balance disturbances. The hair cells of the cochlea and vestibular system appear particularly vulnerable to aminoglycoside injury, and damage sustained during treatment is typically permanent because these sensory cells have limited capacity for regeneration. Ototoxicity can develop during treatment or even after discontinuation of the medication, sometimes manifesting days or weeks later. Risk factors for aminoglycoside toxicity. Multiple patient and treatment-related factors influence the likelihood that an individual will experience aminoglycoside toxicity. Understanding these risk factors allows clinicians to identify high-risk patients and implement preventive strategies. Pre-existing kidney disease substantially increases the risk of both nephrotoxicity and ototoxicity, as impaired renal function reduces aminoglycoside elimination and promotes drug accumulation. Advanced age associates with heightened toxicity risk, partly due to the frequent coexistence of age-related kidney disease. Certain medications, when combined with aminoglycosides, particularly other nephrotoxic agents and loop diuretics, synergistically increase toxicity risk. Key points: pre-existing renal impairment or chronic kidney disease significantly elevates toxicity risk. Advanced age associated with reduced drug clearance and baseline kidney function decline. Concurrent use of nephrotoxic medications including amphotericin B, NSAIDs, and cisplatin. Loop diuretics that increase aminoglycoside accumulation in renal tubules. Dose-dependent and concentration-dependent toxicity patterns. Aminoglycoside toxicity demonstrates concentration-dependent characteristics, meaning that higher drug concentrations produce disproportionately greater risk of injury. This pharmacokinetic principle has important implications for how these medications should be administered. Extended exposure to aminoglycosides, whether through continuous infusion or frequent dosing schedules, typically produces more toxicity than equivalent total doses given in less frequent, higher concentration administrations. This understanding led to the development of extended interval dosing strategies, where larger doses are given at longer intervals, allowing for periods of lower serum concentrations and reduced drug tissue accumulation. These dosing approaches have demonstrated reduced toxicity while maintaining therapeutic effectiveness for many clinical applications. Clinical recognition and monitoring strategies. Early detection of aminoglycoside toxicity is essential for minimizing permanent organ damage. Clinicians must implement regular monitoring protocols for patients receiving these medications, particularly those with risk factors. Serum creatinine measurement provides a basic indicator of kidney function, though it responds relatively slowly to acute changes in glomerular filtration. More sensitive measures such as cystatin C and calculated creatinine clearance can detect kidney dysfunction earlier. Baseline and periodic audiometry testing helps identify hearing loss before it becomes clinically apparent to patients. Vestibular function assessment may be warranted in patients with balance complaints or extended aminoglycoside exposure. Key points: baseline serum creatinine and calculated creatinine clearance before initiating therapy. Regular monitoring of serum creatinine during and after treatment completion. Therapeutic drug monitoring to maintain aminoglycoside concentrations within target ranges. Audiometry testing for patients with auditory risk factors or prolonged treatment. Pharmacokinetic considerations and dosing optimization. Therapeutic drug monitoring of aminoglycoside serum concentrations has become an important component of safe prescribing practice. Peak and trough concentrations can be measured and compared against established target ranges specific to the infection being treated and the patient's renal function. Extended interval dosing regimens have largely replaced traditional multiple daily dose approaches in many clinical settings due to superior efficacy and reduced nephrotoxicity. These newer dosing strategies exploit the concentration-dependent bacterial killing and post-antibiotic effects of aminoglycosides while minimizing cumulative renal toxicity. Individualized pharmacokinetic dosing calculators and software platforms can help clinicians determine optimal doses based on patient-specific factors including age, weight, and renal function. Protective strategies and toxicity prevention. Several evidence-based strategies can reduce aminoglycoside toxicity risk without compromising therapeutic effectiveness. Maintaining adequate hydration and urine output enhances aminoglycoside elimination through the kidneys and reduces tubular drug concentration. When possible, alternative antimicrobial agents with lower toxicity profiles should be considered for patients with significant risk factors. Careful drug interaction screening prevents inadvertent combination of aminoglycosides with other nephrotoxic agents. Limiting treatment duration to the shortest period necessary for clinical cure minimizes cumulative drug exposure. In patients requiring prolonged antimicrobial therapy, periodic reassessment should determine whether continuation of aminoglycosides remains necessary or whether transition to less toxic alternatives would be appropriate. Key points: maintenance of adequate hydration and urine output during aminoglycoside therapy. Extended interval dosing regimens rather than traditional multiple daily dose schedules. Therapeutic drug monitoring to optimize concentrations while minimizing exposure. Avoidance of concurrent nephrotoxic agents when clinically feasible. Clinical decision-making and patient selection. Appropriate use of aminoglycosides requires careful consideration of the risk-benefit ratio in individual patients. For serious gram-negative infections where aminoglycosides provide clear therapeutic advantages, the benefits typically outweigh the toxicity risks with appropriate monitoring and dosing optimization. Conversely, patients with severe pre-existing kidney disease, significant hearing impairment, or multiple other risk factors may warrant alternative antimicrobial choices even if aminoglycosides would be effective. The clinical context matters substantially. an ambulatory patient with uncomplicated urinary tract infection faces different risk calculus than a critically ill hospitalized patient with sepsis from resistant gram-negative organisms. Shared decision-making that incorporates patient preferences, clinical severity, available alternatives, and individual risk factors produces the most appropriate treatment decisions. Managing aminoglycoside toxicity when it occurs. When aminoglycoside toxicity is detected or suspected, prompt management can prevent progression to more severe injury. Discontinuation of the offending drug represents the most important intervention, particularly for ototoxicity where further exposure risks additional permanent hearing loss. In patients with aminoglycoside-induced kidney injury, renal function typically begins to recover gradually after drug cessation, though complete normalization may take weeks to months depending on severity. Supportive care including maintenance of hydration and management of electrolyte abnormalities facilitates recovery of renal function. Dialysis may become necessary if kidney injury progresses to advanced stages requiring renal replacement therapy. Long-term follow-up monitoring allows assessment of ultimate recovery of renal function and permanent sequelae such as residual hearing loss. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.